Namaskar, I am Dr. Rahul Pandit, and you are watching the 469th non-stop edition of Dr. KK's Med Talk Show. Let's have the headlines of the day. The Delta plus variant lineage AY 4.2 has been detected in the states of Madhya Pradesh and Maharashtra. The AY 4.2 has been identified from over 19,000 samples collected from Kerala, Telangana, Andhra Pradesh, Karnataka, and Jammu and Kashmir between May end and mid September. India's COVID 19 vaccination coverage has crossed 102.8 crores up until now, which is a very great achievement. With this, I would like to start off the show for today. And Professor Dr. Shashank Joshi, who is our dear friend and who is with me on this show, will be joining shortly. He probably just held up in a little meeting before, which was still has not got over. But I think what we are going to talk about today is the global scenario for COVID 19 and what is it that India needs to learn from that. And if you could see the whole last week, there was a very important statement from the WHO chief today. The WHO Director General mentioned today that there have been 50,000 COVID deaths in the last week across the world, which means that COVID has certainly not gone away. That figure itself of 50,000 COVID deaths is extremely alarming. And we need to be very, very worried about saying that COVID and COVID related waves would not strike the Indian subcontinent as such. Let's take each country as it goes. The AY 4.2, the sublineage of Delta plus variant, which I just mentioned about in the headlines, has affected the United Kingdom extremely badly. All the hospitals and intensive care in UK are rapidly filling up. In some of the provinces, it has already filled up significantly, and there is hardly any space available for people to work or to get admitted. Beg your pardon. I think that speaks a lot for a country who has a significant amount of its population vaccinated with two vaccines, is still struggling with the new variant, which is the new lineage of sublineage of the Delta plus, which is 4.2. Now, what is this AY 4.2 sublineage? Well, it is more infectious than the Delta plus. We know that. We probably don't know whether it is more virulent. Virulent means क्या ये बहुत ज़्यादा घातक है? Is it causing more severe disease? That is not very clear because by definition, Delta itself and Delta plus itself were extremely virulent as well as infectious. So infectivity definitely of this AY 4.2 is more, but we haven't really seen the virulence of it. Because of which there is a significant talk amongst the United Kingdom to see whether they want to introduce another curbs on the movement of the population. May not be a lockdown, but I think that's certainly been discussed in the healthcare settings there. Similarly, in the last 2 weeks, you must have heard about Beijing and surrounding provinces. Though the news is not very clear as you would get from United Kingdom, but certainly there is a significant amount of problems in case rise in these provinces in China, because of which lockdown and people's movement has been introduced, and we are looking at curbs which are going to be stronger and stronger. Similarly, Indonesia is having significant rise. I heard Romania is also having a significant rise. So I think there are countries now which are again seeing third or fourth wave. Japan, I was told, has just come out of its sixth or seventh wave. And that's a significant finding again by itself. I think these number of waves which are there, which are coming back, needs to be basically looked at in an objective way. And we should understand that this is a warning for us that don't take COVID appropriate behavior lightly. Don't take COVID 19 as a virus as a lightly. It has already created and wreaked havoc with us in the second wave. And God forbid, if we get a third wave, all of us feel that if we don't have a very different variant, we may probably not get the amount of load on the hospitals. We may still get positive patients, but God forbid if we have a patient have a strain which is essentially having more virulence or infectivity than the current strain, which is the Delta strain, then we may land up in a very bad situation. And where what is happening currently, as you can see, that we are looking at having patients who are coming to the hospital, but they are fortunately not that sick. Many of them are being treated at home. Many of them are being home quarantined. Some of the high risk population in a particularly in those area in those fields where people are able to take the monoclonal antibody cocktail, they are taking up the monoclonal antibody cocktail. I think these are some of the things which are helping us currently. Those who are getting admitted are requiring steroids if they are hypoxic, and we are helping them out with that. But we are not seeing a burden on our hospitals. We are not seeing a burden on our outpatient departments or the wards or the ICUs. So we need to be in this situation. This is the happiest situation we can be. We can be in a situation where we may not have significant amount of patients coming into the hospital, but we would still have a lot of breakthrough infections. Now, what are the things which the world is trying to tell us? It is not a message which they are going to give us and say that, hey, India, be careful. I think we have to interpret the situation which they are going through and try and adopt to it very quickly. So, some of the things which I think we need to understand is that the gap between the two doses, because it was 84 days, which is scientific, people have not gone back and taken their second dose for Covishield. I think that people need to realize and go and get themselves vaccinated. I think those people who have missed out on their second dose, the number is significant. And I would urge all of them to make sure that they complete their vaccination profile, whether it was Covishield or Covaxin or Sputnik. You please go ahead and take your second dose as quickly as you can so that you will be vaccinated well. Secondly, the government is obviously trying extremely hard to complete the vaccination drive. And shortly, in a few months' time, or maybe in a few weeks' time, we would also hear a little bit more about the pediatric vaccination program, how it is going to be rolled out, when it is going to be rolled out. I think that would be the time when we would like to have our pediatric population vaccinated as well. But until that time, mask seems to be the best vaccine against all variants. No matter what the variant is, mask is the best vaccine which can be taken up. And it's something which is in your hands. It is something which has shown to have no complications. It is something which is very easy to follow. You just need to discipline yourself. And if you are disciplined well, you will continue to have a very, very safe working. You will be able to work quite well. So what can we expect in the next few months? I think if we can complete our vaccination program as quickly as possible, as have almost 70 to 80% of the population vaccinated with two doses, that means cover up more than 150, 160 crore population with both the doses, 150, 160 crore doses being given to our population, which means around 80% of our population is vaccinated. I think we will then be sure that the third wave may not stretch our hospital system, may not cause a lot of mortality, may not cause a lot of death. I think any vaccination program which is aimed, I repeat again, is aimed at decreasing the deaths and nothing else. And if we are able to decrease the deaths with that, I think there is nothing better than that which we can do. And the vaccine, post-vaccination data, whichever has been published up until now, all of them consistently show that we have a significant amount of decrease in the number of patients who are dying post vaccination. I think that's where we are. I would be happy to take up any questions if there are any questions from uh, the the participants who are listening, the listeners who are listening to us. Otherwise, I would take up a little bit more into a few other things which I would like to discuss. And one of the things which I would like to discuss today is that people talk a lot about booster dose. And I am getting calls every single day. When should the booster dose be taken? would the booster dose be available or not, so on and so forth. Let me tell you all one thing. Until and unless the booster dose is available from our COVID app, which means that they will be able to generate a certificate for a booster dose, please do not take a booster dose. There would be people who might be going across and having some booster dose available to them. That's not official. Please do not think about booster dose. The government is keeping a very close eye on this subject, and they will come across and have a booster dose for people who are received their vaccines early on, or people who are immunocompromised, perhaps healthcare workers who are the vulnerable population. So Nidhi Dhawan, that's your question, and I think they would probably need booster dose very soon. I am agreeing on that point. I don't disagree with that point at all, but I think we need more data about Indian patients, Indian subjects. We cannot be relying on mRNA vaccine data, which is coming from UK. That's one thing. The second thing is that we need to be aware that which vaccine to take, whether to take the same vaccine as a booster dose or a mix and match would be required. And that's another thing which we need to look for. Apurva ji is asking, does doxycycline effective against dengue? Absolutely not. Doxycycline is an antibiotic and it has got no antiviral effect on dengue. People use it thinking that it may have some antiviral property or it may be effective against malaria as an anti-malarial. I think you can do that if you think that you are treating malaria. But if there is a diagnosis of dengue, all you need is good hydration and monitoring of the patient's hematocrit and platelet count. Pradeep Kumarji, best medicine for UTI. I think if there is a urinary tract infection and if there is a repeated urinary tract infection, you need to find out first why is the infection happening. One, is the patient diabetic? Is there a repeated blood glucose problem which we are having? Is there an obstruction in the system? And fourth is then which comes up to the antibiotic. I think you need to do a culture of the urine and the blood and find out which antibiotic would be the best antibiotic to be given for a UTI. Remember, for diabetics, the course of antibiotic may probably be longer than normal. You may need to give it for a longer duration than what we usually give. And that sometimes can extend up to 3 weeks as well. So just these are some of the important things which you need to highlight for understanding about UTI. I think any other questions which people have today? Because COVID is very much, here we need to look at COVID and we need to see how COVID is going to basically affect us in the next 6 to 8 months. Okay, Apurva ji is again asking how to get rid of joint pain after COVID-19 illness. Okay, I think we need to remember that joint pain is a sequelae of a long COVID. Usually, what is important is to have some amount of physiotherapy. It's very important that you keep your joints mobile. Don't sort of get your joints immobile. If you just sit at one place and don't move your knee joint, then you are going to have more and more pain. So a little bit of physiotherapy, a little bit of walking, some stretching exercises are going to be helpful. The third thing is that you need to also look at your other joints, and if you have multi-joint problem, go back to your doctor and see whether you are actually having you may have a short course of anti-inflammatory or sometimes a short course of a steroid, just 5 milligrams of pethylprof prednisone a day for a couple of days, 3 days, which will actually help you in improving your joint pain quite significantly. If it's just knee joint, usually exercise is fine. If it's multiple joints, just go back to your doctor and let them have a look. Nidhi is asking, why are we not measuring the true immunity and falsely, perhaps presuming that boosters are mandatory? The vaccines are emulating, non-sterilizing, and for boosters, we would probably need boosted vaccines. So you are right, Nidhi ji. We need to have a second generation vaccine coming in, and the second generation vaccines are being produced as we talk. I am again repeating that we need to discuss about this, get more data. I am not suggesting that the booster dose has to be given immediately. I think unless we talk about it and collect data, we will not be able to actually have a booster dose coming across and being available for all of us. Ramesh Palji, what is the number of platelets we should take care of? I think if this is in context to dengue, We are quite happy for the platelet count to go up to 10,000, sometimes even below 10,000. If we know that it's now reached to a nadir means it's reached to its lowest point, and from here on it will probably increase. If there is no bleeding, then you may probably tolerate platelets just below 10,000 as well. However, if there is bleeding, make sure that you give platelets and you increase your platelet count at least to 20 to 30,000, if not 40,000. Another thing is that God has been very kind to us. The platelets become big in size when they are low, especially in dengue, and usually because of which the bleeding does not occur. Okay. Uh, Pradeep Kumar, sorry, Kedar Joshi ji, people have completed 10 months of vaccine. How much safe are they now? Each person has a different immunity, Kedar ji, and you cannot say that one person's immunity is the exact as the second person's immunity. We need to be very, very clear that the people who have taken vaccine 10 months ago may have a drop in their antibody number, but whether that immunity will be low or not would be determined by the T cell memory as well as the multiple other factors. Generally, people who are healthy, people who are exercising, people who are fit and fine tend to have a better immune response than people who are having comorbidities, for example. In those patients, we need to be very, very careful. Otherwise, it is okay. You can probably have the masking and wait for the booster dose or the next dose of vaccine, which is coming up at probably in a few months' time, if not later than that. Pradeep Kumarji is asking albumin traces in test, gram negative pathogen culture test, leofloxacin antibiotic and Flotral tablet for 30 days. Should I take antibiotics for 30 days? As I said, if it is a repeated culture which is coming positive, sometimes you need to treat your UTI for 3 to 4 weeks at least. It is not unreasonable to treat for 3 to 4 weeks. I would say that you please follow up with your doctor, whoever has prescribed you. Be a specialist if you feel that you have some questions remaining, because unless I look at the culture report and see which culture is positive, what bacteria is it, it is difficult to give a answer without clinical examination. But yes, it's not uncommon to treat patients for up to 3 to 4 weeks with antibiotics. So I would not say that it is something which is out of the context right now. Most people don't agree with 30 days of antibiotic, but in UTI, it's a special case where you need to give antibiotics longer than what one would give usually. I think the questions are slowly decreasing. Let us take up one or two more questions if they come across. Until that time, I would like to talk about some new symptoms of COVID which are coming across. Some of the things which have been seen now of late, which are a little bit offbeat. You may or may not have heard of them. Uh, I have now been seeing some patients who have lost the sense of smell. You may say, what's new in that? It has remained like that for almost 8 to 9 months. That's one thing. The second thing is that they are experiencing obnoxious smells very strongly, but the fragrances are not been appreciated by them. The fragrance of the food which they eat is not been appreciated by them, and hence they are not able to enjoy the meal. They are not able to smell the perfumes, the flowers, the fragrances which are good, but they keep on smelling obnoxious smells, which may be a rotten egg or a rotten fruit or something. The smell of that obnoxious thing comes much more stronger to them than what they would normally have smelled. I think these are some of the things which are very, very patient centric. They may not be seen in majority of the patients, but this is what some of the patients are describing us and telling us about it. The other thing which I'm seeing, and I don't think that's new, but of late I saw 2 or 3 cases, and those 2 or 3 cases were that people had acute sensory neural deafness. SN loss is what the ENT surgeons call it, a sensory neural loss, where suddenly the patient becomes deaf in one ear. There are some steroid therapies, intratympanic steroid therapies, some therapies which improve their circulation. Those are the therapies which are there. And I think we need to increase that awareness so that if at all it happens, people seek ENT opinion very quickly and not think that they have got some wax in the ear and because of which they are hearing less. Uh, so Praveen ji is asking, his BMI is 30. If I trim down to 24, 25, what are the chances of blood sugar under normal range? Now it is increased. 100% sure, if you decrease your BMI, your blood glucose will also have better control and may improve. And there is good evidence to say that every kilogram you lose, every time you come out of the BMI, 1 or 2 points later, I think then we need to be sure, we need to be very, very assured that it is only going to have a positive effect on our health and there will be no negative effects on the health. I think that's what we need to realize. Nidhi ji need to be done within 48 hours. I'm just wondering what needs to be done within 48 hours. Um, I don't know what that means, but probably uh, urinary test or something. I have no idea what we are talking about. Anyways, I think one thing which I would like to just say at the last, and this would be the last thing which I would say for today, is we have quite often also seen a lot of patients who are getting positive in a cluster still. Yesterday, I heard of an incident. I have not read it anywhere in the newspaper, but people are saying that we need to have. So, no, there was an aircraft in which a few patients came positive very quickly. Within a span of 1 day, there were 5 or 6 patients who came positive who had got off that aircraft. I need to get more details of that. Yes, sensory neural deafness needs to be treated as early as possible. The best results are seen within 48 hours. I completely agree with you. The second thing which I was mentioning is that we are seeing some buildings, some clusters within the buildings which are coming positive. That means that we still have a lot of patients who are sort of not having the COVID appropriate behavior within their society, within their household. They are giving away the mask, and that's when they are catching infection. So my last submission to you would be, which I always say and always do, is one, please, please, please wear a mask. COVID has not gone anywhere. COVID is very much here, and you will have to continue wearing a mask until 31st of December 2022. I keep on saying this all the time. And the reason is mask is the best vaccine against all variants. Stay safe, stay healthy. We are having Diwali week coming up very, very shortly in a few days' time. My wishes for all of you to have a safe and happy Diwali in advance. Of course, I'll be seeing you next week as well, and we would probably exchange the pleasantries and greetings then as well. But while you are preparing for Diwali, make sure that you shop safely. Make sure that you do not have a breach in your COVID appropriate behavior, and you are able to have a very good Diwali festival with your family. With this, thank you very much. Dhanyawad.